In this video, I will be showing how I went about performing a 2.2 phaco emulsification in a sort of a soft cataract with a slightly mid-dilated pupil. So after putting my 2.2 incision and both my side ports, I stain the capsule with trypan blue and expel both the air as well as the trypan blue with 2% HPMC. I just lubricate the cornea with the same HPMC and go ahead and fashion my capsulorhexis with my cystitome. Going as close to the pupillary edge as possible. And with a few deft movements, that's done. I then go ahead and do my hydrodissection. Make sure that the wave goes right across. I'm seeing the nucleus come forward. I even rotate the nucleus with the cannula itself. And after placing some HPMC, I go ahead. This is a very soft cataract, so I don't think I will be able to chop it. So I decide to go ahead and do the stop and chop maneuver, taking a blunt chopper in my left hand. So initially for sculpting, I am at very low vacuum and aspiration rate, just 18 aspiration rate and 150 vacuum, and that itself is pulling the nucleus. Just see that. So I just sculpt, make sure, and there you have the first crack. And I just progress this the crack across. However, just to make sure, I rotate the nucleus 180 degrees. Make sure it is cracked through and through. Yeah, that's it. I then rotate the nucleus for better access. The pupil has shut down on me. I have to be a little careful. Just get a hold of it, chop it, and start eating. And at this point in time, my vacuum is up to 400. My aspiration rate is around 40, and I am in the pulse mode. For sculpting, of course, you use continuous mode. Having a bit of a problem getting out because of the small pupil, however, I am able to manage. That's part of the epinuclear shell, that's managed, and now I just turn the other heminuclear across. So even though the pupil is small, I am able to manage pretty well. And with that, the other heminuclear is also dealt with. Just be very careful you don't catch your iris. It's only at this point in time that I put in some intraocular diluted adrenaline. It's actually intraocular adrenaline. So, and the pupil has dilated a bit, nothing great. I then take my bimanual and very carefully clean the entire cortex from 360 degrees round the back. There are some epinuclear bits also, and that will be a little more difficult to aspirate. I switch hands and take the cortex from the other side as well. Then put some HPMC and inject my foldable. I will try to inject the foldable directly into the bag. Single piece hydrophobic, and just easing it into the bag. That's done. The final finishing steps are that of removing the HPMC, putting your intracameral antibiotic, and hydrating the wounds and the paracentesis. Thank you very much for watching.